Hi, my name is Dr. Charles Feinstein, and we're speaking to you from my office on Lakeshore Drive overlooking beautiful Lake Michigan. This is where we do all of our urological and urogynecological work. We do bladder suspensions, prolapse repairs, and we have special expertise in urinary incontinence and in complicated cases of urinary incontinence, and particularly in cases of urinary incontinence that have been treated by other doctors elsewhere where the treatments have not worked or have not been sufficient to make the patient happy. And today I'd like to talk to you shortly about injecting Botox into the bladder. This is the exact same Botox that's been used for 30 years for injections into wrinkles and creases in the skin. For example, these wrinkles that I have right over there, they'd be perfect for Botox injections. And that's a cosmetic application of Botox, and we're not going to talk about that today, but it's the same Botox. And for 10 years, we've known that Botox is very effective for incontinence problems that have to do with the overactive bladder. That's the bladder where you get an urge to go to the bathroom, you get a sudden warning, and you run to the bathroom, and by the time you get to the bathroom, it's too late already, and the bladder said, that's it, I gave you enough time, you haven't gotten to the bathroom, I'm shooting all the urine out. The urine comes out without any control whatsoever, and the man or the woman is soaked. And that's called the overactive bladder, and worse than that, it's called the wet overactive bladder. And this is a very common problem. As a matter of fact, the standard treatment for the overactive bladder is medications, and there's at least 10 different medications that are available. The pharmaceutical companies are making fortunes on these medicines. As a matter of fact, the overactive bladder medications sold over $6 billion of medications last year alone. And the problem with these overactive bladder medications is that very often they don't work, or the side effects may be intolerable to the patient. How do we know that? Well, the pharmaceutical companies give us the data. They told us they've sold last year $6 billion worth of overactive bladder medications. And these are medicines that have to be taken every day for the rest of your life. And the pharmacies give us the renewal rates on these medicines. And the renewal rates are only 10%. So from that, we can infer that 90% of the people who have these prescriptions for overactive bladder medications never refill them, either because the medicine didn't work or because the side effects were intolerable. Possibly it's a question of cost and a question of health insurance coverage. There may be many factors, but the point of the matter is 90% of these medicines never get renewed. So the problem is overactive bladder. Botox does not work on stress urinary incontinence. In other words, if you lose urine when you cough and sneeze and laugh and dance and jump, have sexual relations, when you're screaming at your children, when you're screaming at your husband, that's called stress urinary incontinence, and there's a 15-minute procedure which will cure that problem, but that's a minor surgical procedure. Botox will not work on stress incontinence. However, for overactive bladder and the failures of the overactive bladder medications, Botox is perfect. We've been using it for 10 years, mostly in New York City and in Los Angeles on the eastern and western seacoasts. The reason for that is that up until a few months ago in the state of Illinois, the medicine of Botox was not covered by the insurance company. That just changed a few months ago, and now Botox is paid for and is covered by every single insurance company in the state of Illinois, including Medicare, including public aid, including Blue Cross, including all of the major commercial health insurers, for example, Aetna and Cigna and Humana. They all pay for Botox injections when it's given under the correct criteria for the exact correct reason. And the reasons and the criteria are very important, because if not given for the correct reason, the insurance company will not pay for it. Botox works by partially paralyzing the bladder. The way that we give Botox in my hands is that the patient comes into our operating facility in our office. We have a fully functional operating room, which if you'd like to see, feel free to take the tour on our video tour of the office on YouTube or on the webpage, drfeinstein.com. And in the operating room, I give the patients general anesthesia, although other doctors can do it under local, but I can't have the patient bouncing around on me because the location of the injection is very critical. Under anesthesia, we do a test called a cystoscopy, which means we look inside the bladder with a telescope, and then we usually do 20 to 30 Botox injections in a geometrical pattern inside the bladder using very special catheter needles where the catheter goes inside the bladder through the telescope, through the cystoscope, and at the end of the catheter is an injection needle, and we inject very small, extremely minute amounts of Botox, but we do it in 20 to 30 different locations in the bladder. Now, there's a problem with Botox injections in the bladder, and that is a theoretical problem in that it can paralyze the bladder. We want it to paralyze the bladder to a small degree so it stops the bladder contractions and the overactive bladder incontinence. We want it to do that. So we want it to partially paralyze the bladder. We do not want it to fully paralyze the bladder. Otherwise, the patient will not be able to urinate. This has never happened in my hands, although it's theoretically a possibility. So in my hands, what we do is we teach every single patient, before we give the Botox injection, we teach the patients how to catheterize themselves with a small 4-inch or 6-inch catheter. We teach them with a mirror, we show them the anatomy, and we teach them and have them do it themselves to learn how to self-catheterize. That means how to put a catheter into your own bladder and drain out the urine if it should be necessary. In all the dozens of patients that we've done so far, it has not been necessary even once. So I think it's a theoretical problem more than a real problem in that we've never had a patient have to do it. But that notwithstanding, we teach every single patient how to catheterize themselves, and they go home with a catheter that we provide them, just in case there's an emergency, just in case they have any trouble urinating. They can do it at home and take care of any problems that arise. But like I said, we've never had a patient have to do that. So the Botox injections, 20 or 30 of them into the bladder, partially paralyzes the bladder muscle so that these uncontrolled contractions of the bladder stop. And we've had the most dramatic, unbelievable results from Botox injections. We have had patients that were wearing 3 to 5 diapers per day, adult diapers, and soaking through them. We've had patients who were totally untouched by all the bladder medications that never worked on them, wearing anywhere from 5 to even 10 adult diapers per day. And many of those patients have been completely cured by the Botox injection. How do we know they've been cured? They've gone from wearing 8 to 10 diapers or 4 to 5 pads per day down to 0. The Botox injections in about 80 to 90% of our patients have had the most amazing, outstanding, successful results. They have completely stopped the overactive bladder. They have completely cured the urinary incontinence, and we've had many, many patients who have failed on the overactive bladder medications go from being soaking wet, wearing multiple pads and or multiple adult diapers per day, down to 0, not wearing or needing anything. And these patients, it's like a brand new life. They have been transformed. Their lives are all of a sudden fun and enjoyable again. They're not embarrassed anymore by urinary incontinence. They're not depressed anymore by urinary incontinence. They're not living their lives figuring that the next time there's a bladder contraction, they'll wet their clothes and be embarrassed in public. And the nice thing is they're saving a lot of money because they don't have to buy $2,000 to $3,000 worth of pads or diapers a year as they previously had been doing. Some of the medicines which are given for overactive bladder include Vesicare, Detrol, Ditropan, Sanctura, Enabolex, Gelneek, oxybutynin, Tofranil, and I'm sure there are many more that I have not mentioned in this short list. In many patients, these medicines work very well. However, the long-term results are that 90% of patients stop taking them after a short time, either because they don't work or because the side effects have become intolerable to these medicines, or there could be a cost factor, a price that's prohibitively high, or the patient may not have sufficient insurance. The nice thing about the Botox is that it is now in the state of Illinois covered by every single insurance company when you show them the proper criteria, that you've done urodynamic evaluations, that there is an overactive bladder, that there's a neurogenic component to the overactive bladder, that there are uninhibited bladder contractions that will not be corrected by these medicines, and that you have to document that the patient has already tried 2 different overactive bladder medications and has failed on both of those overactive bladder medications, in which case you have fulfilled the requirements of the insurance companies. We pre-certify all of our insurance companies, and the insurance companies have paid for the Botox in every single case. We have not had any cases where the insurance has not paid for the medication since they changed the laws recently, a few months ago, in the state of Illinois, and now permit us to use this medication, Botox, which has been revolutionary in our practice in that it has improved the lives of countless numbers of patients. Like I've said, it's been used for 10 years, so we know about the safety, but it's only been used on the East Coast and the West Coast because even though in those states their insurance companies also do not pay for the Botox, they seem to have wealthier patients than I do, and their patients seem to have no problem coming up with $5,000 or more in cash to get these Botox injections, if you include the price of cystoscopy and anesthesia and everything else, and the Botox can cost thousands of dollars per dose. So on the 2 coasts, they seem to have an abundance of wealthier patients than I do, and that's why we have not spent much time trying to get patients to use Botox until the last few months, when it's changed everything because the insurance companies now pay for it. Now that they pay for it, it's eligible to almost everybody. Not everybody, but the patients who fit the very strict criteria. And we've mentioned those criteria. So it's a wonderful treatment. It's very effective. And if you ask the question of does it last forever, the answer is of course not. Nothing lasts forever. And we hope to get 6 to 9 months of effective use from each injection of the Botox. We tell most of our patients that they can figure that every 6 months they're going to need to have the Botox injections redone. But consider that that's instead of taking pills every single day, and that's instead of changing 4 or 5 pads or 4 or 5 adult diapers every single day for soaking wet incontinence. So the Botox has been a tremendous help to our practice. It's been a tremendous help to our patients. Patients have discovered a new life, been able to do all kinds of new activities that before they were ashamed and embarrassed and afraid to do. So again, if you have any questions about injection of Botox into the bladder, feel free to call us at our office. The phone number is 847-291-9058. And our magnificent surgery center is located on the beautiful shores of Lake Michigan in Chicago, on Lakeshore Drive and Lawrence in Chicago. We're about a 5 to 10 minute drive from downtown Chicago. We're on the north side of the city. We welcome your inquiries. If you have any questions, feel free to call us, write to us, come visit us. We specialize in the patients with the difficult to control incontinence problems, and particularly in patients who've had treatment in the past by other facilities that has not worked to cure their incontinence. We look forward to seeing you, to meeting you. Thank you for watching this video, and I look forward to any questions that you may have. It would be my pleasure to answer them either by email or in person. Thank you very much.